Good evening. I am Katie McCall. I'm part of the My Pet Nutritionist team. I'm here this evening to talk to you about disease or dis-ease, as I like to discuss and talk about it. So really this evening's about just helping you understand how we approach dis-ease within your pet and really trying to understand the difference between how we would approach that and conventional vets. So we are very used to having, if we unfortunately have an ill pet, we would take it to the vets, just very much like we would go to a doctor's, and we would usually use medication or testing, whatever it might be, to get to the diagnosis and then to treat that condition. And that really has an amazing role. We are so incredibly lucky to have fantastic access now to really high standard veterinary practices. We have access to IV fluid therapy when it's needed, to antibiotics, obviously painkillers, absolutely, and to really quite sophisticated diagnostic tools. And I guess I just wanted to share with you a little bit, about my experience within practice of that, and then also how I've kind of developed and evolved to also look at disease in a slightly different way through my experience. So obviously when I started my career, I was in practice, and day in, day out saw many cases of acute illnesses, which mean things that come on quickly or accidents, where all of those equipments and medication were used and were very important and absolutely saved that animal's life and made them very comfortable and brought to the end a lot quicker a situation that may have been prolonged suffering for that animal. So we're that was a fantastic experience. But what I also saw day in, day out was a lot of chronic diseases, such as gastro issues, such as diarrhea or vomiting or anal gland emptying or itchy skin, chronic ear infections that were never really satisfying to treat, because you'd be in this cycle of treating with antibiotics, and then the issue would reoccur, using steroids, and that would be okay for a while and do the job, but this animal would then have to be on steroids for a long period of time. And and a lot of people, a lot of owners are actually much more instinctive about the health of their pets than they are about themselves, in that it doesn't feel right to have an animal that has this recurring infection, or they don't want their animal to be on immune suppressant or high dose steroids for life to control an itchy problem or sore ears. And I've actually been there myself as an owner, and I've had to reach for those certain drugs, and I know that it didn't cure the problem long term that I still had a long-term issue. I could just control it in the short term until it flared up again. So our approach is not to create those short-term fixes. There is a certain psychology, I think, in our society about getting, if something cures an issue quickly, you come out of the vets with a medicine, in 24, 48 hours you see an improvement. It's very satisfying, and we get that instant reward almost. It's that kind of addictive psychology that we have. You get that instant gratification. You're relieved as an owner that your animal feels better and everything's okay, but it usually will rear its head up again a few weeks later. So our approach is to break that cycle, basically. So our aim is always to deal with the underlying cause of the disease rather than treating the symptoms or reducing the symptoms. Obviously, where we can, we always will support reduction in symptoms, especially if there's inflammation. But it's really a much more long-term, sustainable approach to reducing chronic diseases in your pets, and a lot of these principles applies to human health too. So when we look at a naturopathic approach, we also look at the body in a slightly different way. So when you go to veterinary college, or you're taught medicine, you learn about the organ systems very individually. So we're taught the bones of the body, their names, what they do, and then we would move on to respiratory system, how that functions, and move on to the circulatory system. But actually, naturopathically, we look at how those symptoms talk to each other and the fact that they are actually massively interconnected, and that an unhealthy unhealthy organ system can lead to certain symptoms throughout the whole body, not just within that particular organ system, and how they interrelate and how that might show in your dog too. And sometimes those connections aren't necessarily thought about in more conventional medicines. A really nice example of that actually is like acid reflux. There's a lot of correlation, and it is researched actually in human fields, a lot of correlation between acid reflux and spinal injuries or skeletal injuries, and actually having chiropractic sessions to correct your skeletal system and keep everything aligned can actually really reduce acid reflux, just as a really nice clean example. That's a really clear-cut one, but there are a lot of more complicated connections. And I think it's just really important to begin to think of the body in that way. And then another really nice example of that is if we're nervous, for example, we have some anxiety, we all know that we feel that in our stomachs. So we get butterflies, that's something that everybody readily accepts, that you have butterflies in your tummy. So, that just illustrates as well the connection between the brain and the digestive system. And we're covered in fascia, we're covered in a connective tissue. It's like a spider's web, really, is clear connective tissue that joins all our, visceral intestine together, and so manipulating or injuring one part of yourself can have an effect and will affect other aspects of your body. And the body is always trying to restore itself to health. The body is an amazing thing. Mammalian physiology is always trying to reach homeostasis, which is everything within its normal limits. So it works really hard and does an incredibly amazing job to do that. But sometimes things go wrong. Now, whether that's a genetic issue, so there might be the lack of a gene to methylate, for example, and reduce histamine and adrenaline in an animal, or we might have environmental factors such as a poor diet or a heavy worm burden that's led to us having to give long-term antibiotics or heavy antiparasitic drugs, and that will have affected the microbiome, for example. So there are sort of certain environmental situations that set up our body to not be able to bring itself always back to that level of health and homeostasis that it's trying to achieve. So our job as naturopaths is to get in there. It's to get in and help the body make sure it's got all the ingredients that it needs to be able to bring itself back together. A really common issue we see is immune reaction. Immune symptoms such as itchy skin or digestive symptoms is so common, and a lot of factors are sometimes missing in those dogs that they need to bring the Th1 and Th2 immune system back into balance again. And often, sometimes we'll do testing to see whether that animal is deficient in a particular nutrient or its microbiome is really poor, and then we can be quite specific in targeting how we put those ingredients back into your dog to then help them bring around homeostasis, which then means that instead of people coming to us and saying, right, my dog can only eat goat, I need a diet based on goat, absolutely, let's address that now for the next few weeks. But while we're doing that, let's also look at the long-term underlying cause and begin to treat that. So in a few months' time, the reactivity won't be there, and you can enjoy lots of other foods, not just goat, or and you can explore other foods. And another, really, I think really I wish I'd known about a long time ago is recurrent ear infections in dogs. When I was in practice, we used to see dogs that would have just dirty chronic ear otitis externa, chronic ear infections, and they'd come in, you'd clean the ears, you'd put some antibiotic ointment in, and everything would be good, and you'd feel that satisfaction, and then it would reoccur because you're not dealing with the underlying cause, which actually quite often is allergy based, immune based. Some dogs suffer a lot if they swim a lot, but some dogs also suffer because they are having an allergic reaction. It actually comes out in their ears. And that connection is not talked about very often, more now, but it certainly wasn't, historically. So people might not have that understanding. But what we're actually doing is we are wiping away with those antibiotic drops. We're also wiping away the good guys, the good bugs that lives on our skin, and we also have microbes in our digestive system that should be keeping those pathogenic bacteria at bay and keeping the levels really low. I often think of it as a rainforest. So our body is an ecosystem. We have many living beneficial bacteria on yeast and things, microbes really on our body, and they do a job. They're here to serve us. We have evolved with this, and our breeding and our society with its worming, its antibiotics and its chemicals are degrading that microbiome. And it's a bit like knocking down a rainforest in which there was multiple species living in absolute harmony together. So we've deforested our skin or our digestive system by using antibiotics or ointments or antifungal wipes, whatever it might be. And what that does then is create an opportunity for weeds to grow, or pathogenic bacteria or microbes. So in the UK here, if we were to deforest an area, we would be invaded probably with nettles. So you tend to get one species invading a space where there's no other species to keep that one in check. So nettles are allowed to be there, but we don't want that whole forest to be 100% nettles. We want a variety of species, and that's how you need to think about the microbes in your ears, and the digestive system in your dogs. You need a variety of beneficial bacteria to keep those one pathogenic at bay. So the only way we can get rid of the nettles is to probably spray that area, right? So we're then having to put on antifungal, antibacterial to get rid of the nettle alternative microbes in our ear, which is fine. It works for a while and it calms that down, and then lo and behold, 6 weeks later the nettles are all back again. So hopefully that's an illustration for you to understand how, unless we treat the root cause and unless we try and improve those colony of broader species within that environment, we're going to keep getting repetitive reoccurrences of the pathogens. So we need to be planting multiple plants in our rainforest, or probiotics in our animals, and then feeding those, so making sure they're given an environment which they can thrive, so by fresh feed, for example. And that's really where a lot of us will start, is by looking at the microbiome, especially in the digestive system. That's responsible for so many organ systems. It's related to everything: kidney and liver function, brain health, obviously digestive health, pancreas. It's just related to everything in general, inflammation within the body in general. So making sure that is healthy is really where a lot of our approach will come in helping support disease. And then obviously we can look at individual factors within that specific disease to then make sure that, for example, if you're getting an autoimmune reaction, we've got enough vitamin C and vitamin D. We can put healing supplements in, like glutamine, into the digestive system to help that lining repair itself, to create an environment where the microbes can really flourish. And then that microbes really does the job for you. It's a defense mechanism. It's helping you to prevent against disease. It's your army, to prevent against chronic disease, pathogenic invaders, and in general body inflammation. So that's kind of how we would approach a disease if you were to come to my pet nutritionist. And it's about, as I say, helping you control those symptoms in the short term whilst long-term healing occurs. And sometimes we're in a tricky situation because the dog or the cat is in such a bad state that we need those conventional medicines to help us keep this dog comfortable and in control, and they might actually really contradict the way that we approach. So some dogs might be on a 6-week course of antibiotics, and I'm wanting to get the microbiome better, but you can't, if you're giving them the probiotics and the antibiotics, they're just going to potentially kill those straight off. So it's a long walk. It is a very unsatisfying way to treat your dog in many cases, because it's not a straightforward here's your medication, 10-minute appointment, here you go, thank you very much, come back if there's a problem. It's a much more in-depth understanding about the symptoms that your dog is showing, trying to link that to the organ system that isn't happy, easing off medication with the support of your vet where possible, and then introducing other more supportive treatments. A lot of it will be a case of trying new foods and seeing whether you get a reaction or not, which can be really difficult in a busy household. So it's a longer, less satisfying walk, and that a lot of people we can lose along the way, because with society and lifestyles being very busy, it's quite difficult to be able to walk that walk. But I guess a huge part of our role is, after the initial hours consultation, your diet plan and supplement plan is then to support you in the journey and to keep in touch and to help you to keep that going and to keep making changes when I always say the dog will tell us if I've got it right or not, and getting feedback. And sometimes we see changes in symptoms, and to me that's still okay. It's moving on. I mean, I have a cat that springs to mind in particular who had very, very strongly digestive intolerances, and that we cleared and managed that, and it actually then moved to the skin, and now we're working on clearing and moving the sort of other immune responses. So sometimes we'll see a movement or a change, but especially if you have a young dog, which I tend to see increasingly, year-old dogs that are showing these symptoms. Let's make the change early. Let's get the good stuff in early, so we can prevent you from being one of those owners with a 6 or 7-year-old dog that comes to us that is intolerant to every protein, has to go out on a walk muzzled because it will rip the bark off a tree because it's so desperate for fibre for its microbes, has been to the referral centre and had biopsies, endoscopies, spent £5,000, £6,000, £7,000 on treatment. We want to stop that before you get there. So by taking a long walk early on, you're going to avoid the trauma, which I will call it trauma, of being in that state, a much worse state further down the line. And this is just experience of what we see. Everybody's house is individual, everybody's dog is individual, everybody's lifestyle is individual, so there's no judging, there's no if you need to use something immune suppressing because you need this dog control because it's making itself sore and you've got things going on, then okay, we're very real, we understand that, but we can get you as good as we can get you. And also I really love having just explaining some of the alternatives in terms of supplementation. So a lot of veterinary supplementation is licensed and quite strict, and there's a lot of wonderful things out there that we can use that will help your dog that you might not even be aware of. And even if they're just there in your cupboard as a go-to when you have flare-ups, like clay, for example, psyllium husk, for example, they're a much nicer way of treating getting through flare-ups rather than again reaching for the antibiotics. And it can take sometimes 2 or 3 flare-ups to kind of break that cycle. So hopefully that explains a little bit more about our approach to disease. I will absolutely say that, having come from a veterinary background, I always prefer to work with people's vets. I really enjoy that. I understand their concerns about this type of approach, and I am able to talk their language, and I'm very happy to work with your vet to help. So we're all working together to help the dog, ultimately is my aim. And I really respect and understand their education, and so I'm able to hopefully be a bit of a bridge for you between maybe what you're instinctively feeling would be your preferred way to approach a disease and how your vet is telling you or making you feel like you want to do. We always like to see the vet's history, and I always ask you to share everything that we've suggested with your vet. So hopefully that's given you an insight into how we approach disease, or dis-ease as I tend to like to prefer to think about it, and it's giving you just hopefully some confidence that it's a world that you might like to explore. If you have any questions regarding how successful this might be in your situation with your animal, then obviously just either give us a call or bring an email, a little summary of what's going on, and we can obviously talk to you about how we think this will be, and what's involved in terms of you getting through to a better place, really. Ultimately we all just want our pets to be well, and for them to have the best quality of life and well-being that's absolutely possible. So that is always ultimately our aim. So I hope that's been useful, and yeah, please do get in touch if you feel like this is the kind of approach that you would like to take for supporting the disease process that is occurring within your dog or your cat. Thank you.